After birth, the circulatory system undergoes significant changes as the newborn transitions from fetal to postnatal circulation. These changes are essential for adapting to life outside the womb, where the lungs take over the role of oxygenating blood and the placenta is no longer involved in nutrient and gas exchange. The umbilical arteries, which carry deoxygenated blood from the fetus to the placenta, constrict and close shortly after birth. The distal portions of these arteries become the medial umbilical ligaments, while the proximal portions remain as part of the internal iliac arteries. Similarly, the umbilical vein, which carried oxygenated blood from the placenta to the fetus, also closes and eventually becomes the ligamentum teres, or round ligament, of the liver. During fetal life, the ductus venosus shunted blood from the umbilical vein directly to the inferior vena cava, bypassing the liver. After birth, the ductus venosus closes, becoming the ligamentum venosum in the liver. This change means that all blood entering the liver must now pass through the hepatic circulation before reaching the inferior vena cava. The foramen ovale, an opening between the right and left atria, allowed blood to bypass the non-functioning fetal lungs by flowing directly from the right atrium to the left atrium. After birth, when the newborn takes its first breaths, the lungs expand and pulmonary vascular resistance decreases. This leads to an increase in blood flow to the lungs and higher pressure in the left atrium, causing the foramen ovale to close functionally. Over time, the tissue fuses completely, leaving a small depression called the fossa ovalis in the interatrial septum. The ductus arteriosus, a vessel connecting the pulmonary artery to the descending aorta, allowed most of the blood from the right ventricle to bypass the lungs during fetal life. After birth, the ductus arteriosus constricts in response to increased oxygen levels and decreased prostaglandins. Within the first few days of life, it closes completely, becoming the ligamentum arteriosum, ensuring that blood from the right ventricle is directed to the lungs for oxygenation. In fetal life, pulmonary vascular resistance is high due to fluid-filled lungs, resulting in minimal blood flow to the lungs. After birth, the lungs inflate with air, causing the pulmonary vessels to dilate and a significant drop in pulmonary vascular resistance. This increase in pulmonary blood flow marks the establishment of pulmonary circulation as the primary site for oxygenation of blood. As pulmonary resistance decreases and blood is directed from the right ventricle into the pulmonary arteries, effective gas exchange begins in the lungs. The increased systemic vascular resistance after the removal of the low-resistance placental circulation, combined with the closure of the ductus arteriosus, redirects blood flow entirely through the systemic circulation. The heart adapts to these new circulatory demands, with the left ventricle becoming stronger to pump blood through the systemic circulation, now facing higher resistance, while the right ventricle continues to pump blood into the low-resistance pulmonary circulation. Over the weeks following birth, these changes solidify, transitioning the circulatory system from the fetal to the adult pattern, where the lungs are the primary site of oxygen exchange, and the heart operates as a two-pump system with separate pulmonary and systemic circulations. Postnatal circulation involves the closure of fetal shunts like the foramen ovale, ductus arteriosus, and ductus venosus, and the cessation of blood flow through the umbilical vessels. These changes redirect blood flow to the lungs and ensure that oxygenated blood is efficiently circulated throughout the body, adapting the newborn to life outside the womb.